eval for.
I didn't know that.
I just, supervisors with my is where my brain is going, is reduce redundancy. So the contract is in draft, so.
I love it. Do good?
Yeah.
Yeah, trouble.
That's not part of that.
Yeah.
But we're opening the site in Sterling.
I saw it, I got all, it's cool, I got all of the information. Or that's great.
Yeah, yeah,
Calling it the ranch.
yes.
Because when I saw the ranch, I'm like, we do it the ranch. The ranch. And I saw Sterling, I'm like, we're gonna move the ranch.
It has a certain vibe and that's in alignment. It stands for something. We love an acronym, so just trying to get us all geared up for that.
Okay, what else do I need to do? So, yeah.
I'm so Are you working with Tricia?
The Arizona.
She's on.
Yeah.
She was on the Colorado Association.
We were in that.
She
I love it.
She says her
For
term.
a short amount of time, I don't, that's not my. Sure. Have the evaluation.
Yeah.
She got.
Very
She loves it.
Sunset.
Just get a lot of feedback in the wrong way.
So, yeah, it's good. Good. It's been.
So thank you, I guess, for Carol today.
Did you tell me? Yes. Which one? It's just. Go through it.
As far as my second question.
Well, my class.
Right here.
Infrastructure.
And we.
Yeah.
We made. We're good at personalization.
Yeah. Not that it's not alright.
Yeah.
We stayed in a state park.
So.
Yeah.
I was like, I thought it was.
I heard you sign up there. Yeah, yeah. Yeah, they were excited to know the signature.
That was just one.
I can imagine.
Big deal.
Yeah. It's just. So I don't know how to do that. In summer. It's really nice. I would.
Yeah, it was gorgeous. It was fun seeing that.
Yeah.
I'm glad you took a look at the picture and looked at the numbers. Yeah, I passed it to and
already?
Caitlin passed it to me and I passed it to Brian.
Oh, okay.
It was like there was just a problem with the spreadsheet. Yeah. So, yeah, he sort of here and needs to talk about it. So that's all good.
Yeah.
And, but it's, we gotta do that, right? We gotta do strategic.
I know better.
Yeah, it's fun. Yeah.
Oh, that's awesome. Yeah, the door gets locked.
For now.
No, we appreciate your time.
You don't have time for something. So I might jump out of the room.
Yeah, I'm not teaching this.
Your side.
So that we can get on? Yeah. Getting things done. I guess.
Yeah, we like how it was high school, they don't like. Whatever they. Wow.
I see secure. Should be, oh, I see public, is that what we?
Yeah. Sometimes, I mean, it's. Yeah. Just
Yeah,
not
I got
see it.
one of the,
So I have to find a note, so I'm gonna start, if I'm not here, I'm gonna be in and out, I just have like two bills I have, they're actually my bills, so I started this year, so I probably should show up and testify. I had no control over when I came in the committee, so I just learned about this last week, and so I'm like, oh, so, forgive my disruption.
So many proposals.
I just wanted to hear the radio.
After
Oh.
March, I told her, when it gets to next door, it's a lot.
Yeah.
This is almost over. So, yeah, glad that I teach it.
And until we give you money.
Until we figure it out, we're gonna stay in here. You know, I was gonna work. I got national on this meeting. So.
Okay.
There's well been introduced and stuff. That's cool. To have government more federal. They highlighted Colorado.
I was standing right behind you.
It's a house. I used to eat it all.
Goes.
And you know, it's like people.
Ideas.
It says, I need to use this here and expressions. It's on there. Putting on the phone.
Share hat.
Wait a minute.
Well,
Supervisor Pretty good. What, Andrew, too?
Yeah.
Just so you know.
Yeah. Who did he live?
I don't think so.
Okay,
I don't think so.
good.
Anybody else having trouble with me, right? Yeah. Okay, sorry. I can't put it on. Plastic first.
Yes. Awesome.
Yeah. Sorry, I wasn't born.
It's fine. No, we got that.
There we go. Yeah. It's not a name tag.
B.
I'm good, right?
We share the love around here.
I.
All right. So we have a forum, Caitlin? I see three right now. And who's on? Got Aaron?
Yep.
Councilperson. Hi, Aaron. How are you? All right, well, it is 2:00, so let's call the January 25th Regional Opioid Abatement Council Region 2 meeting to order. It's 2:00. Our first item of business is any public comment. Is there anybody that would like to make public comment? No, not hearing it. I'm going to quickly add something to the agenda, just some logistics with administration support. So I turn over to Laura Walker, our Director of Economic and Human Health. Say that right? Human and
You got all the
Economic
right.
To kick it off. So Laura.
Thank you so much. So, thank you, everybody. Caitlin Lovett from my office for the last year and a half plus has been providing the coordination support to this council.
organizing the meetings, posting the minutes, getting them recorded, and basically doing a lot of coordination. While my service area that I'm responsible for in the county is very large, I think it's at about 700 plus employees. In my actual administrative office, there are only 3 of us. And so when workload demands for this group, which have ebbed and flowed over time, but we've all been flying this plane while we're building it. And so it's, you know, we didn't know what we didn't know. But there's no one in my office that can back Caitlin up if there's ever a time that she can't meet a deadline or she's going to be out of the office or those type of things. So Tom went to the trouble of checking in with a number of his public health director counterparts in other large counties to ask how are they doing this, because the public health director is a mandated seat, I think, at most of the councils across the state. Might look a little different in those jurisdictions where they've got multiple counties in one region, but for the most part, the public health directors are very involved in all of these. And in most of those cases, the administrative support has come more from the health department, within the health department, which of course has a much larger infrastructure than my little admin office. And so we are going to be having Caitlin, this will be her last meeting with everybody, but we wanted to thank her for her service and welcome Liv Kraus, who is from the health department. And I might let Tom take it from there to explain what we're going to do with the transition and how Liv is going to be of support to this group moving forward. But thank you, Caitlin, for your work. We really appreciate it.
Yes.
Yeah, let's give her a round. Thank you, Laura, for that. And there's a lot of behind the scenes work that Caitlin is involved in, that there's at least 2 meetings a month. There's the agenda setting in this meeting. And then you saw our packet. She, prowling all this, getting all the information in there. So lots of work, and you're doing it since the beginning of Region 2. And so thank you again, Caitlin, for all your hard work on it. And we'll introduce Liv. Liv works at the health department, and you've been with us now, how long, Liv?
Almost 2 years.
Almost 2 years, and she's amazing. Those two are going to work together, do a really good transition, but Liv does have some capacity and some interest in supporting this region, so why not? And if Liv, one of the big things Laura said, we've got backup. So if Liv is unavailable, we've got some other folks that'll be able to support her. And I think that's key, where Caitlin did not have that. And that was a challenge. So Liv, welcome. And get you joining us. All right. Okay, one other thing, if you notice on the agenda this time, Caitlin graciously put time limits on there. If you all recall, in December, we ran a little bit over. So if we can ask everybody that's presenting or talking or whatever, let's stay within that time limit so we can make sure everybody gets a good opportunity to get involved and present on their work based upon the agenda. It's a packed agenda. We've got a lot of voting things. That's exciting. We've extended this meeting by half an hour, so we will plan on adjourning at 4. So moving along, we got the minutes from the December 14th, 2023 meeting. Any conversation or move to approve?
Mr. Chair, I would move to approve the minutes from December 14th, 2020.
Thank you for that motion. Do we have?
Second.
We've got a second. Any further conversation? See none. All those in favor?
Aye.
Aye.
Is anybody opposed? Hearing none, that passes unanimously. Exciting. We have Marshall with us to provide his presentation that unfortunately he didn't get to last meeting. We apologize. So Marshall, we'll turn it over to you to talk about paradigm shift presentation.
All right, so this is something that's been on my heart, my mind for a while. It's called Paradigm Shift. It is a facility, but it's more than a sober living. It'll have safe centers, specialist, stuff like that in it. The mission is to provide stability, guidance, support, love, compassion, healing, and encouragement to those struggling with addictions and those early in recovery, while we strive to address the underlying issues of addiction, such as grief, trauma, abuse, and other mental health conditions. That way we can help these people get back up on their feet, give them some hope, some love, so that they can live a fulfilling life again. What it is, it's a residential facility for both men and women. I've looked at two different facilities, one that can house 50, one that can house about 23. It's a bridge to fill a gap between treatment, sober living, individuals returning to the streets, as well as facilitating independent living in a place removed from that old lifestyle. I went to detox in March of 2021, got out, and I didn't have anywhere to go. I went right back to the streets, started doing the same thing again. I tried to get into a sober living at that time and they didn't have any openings. So I had one option. And it kind of put me back into that lifestyle for a while until I got a place, a halfway house where I was able to have some stability, some guidance, some support. I was able to get on my feet. It's a home filled with love, compassion, understanding, as well as the guidance, direction, and counseling that individuals will need to succeed. The counseling, mental health, substance abuse, staffed by peer recovery coaches and case management. To me, it's hope in the eyes of the individuals in the early stages of the recovery that they can recover and live a better life because they're going to see people who are doing it themselves. So how our mission can be accomplished, we're going to provide them with the stability, the housing, the structure that they need. UAs, case managers who are going to help them figure out what you need. Do you need a birth certificate? Do you need a social security card? You know, do you need an ID? And then we're going to help them get jobs with employment classes. Like I said, we're also going to provide peer recovery coach, a spiritual advisor. To me, spiritual is anybody that believes in something higher. It doesn't necessarily have to be God or anything else. Something they can look up to. Employment labs and groups, as well as help them find housing when they get ready to leave. They'll be required to obtain employment, submit to random year analysis, pay rent. That's going to help them, you know, start living life again the way they should, as well as be accountable for their actions in the facility and the community. Residents will attend classes at Paradigm Shift on relapse prevention, life skills, cognitive behavioral therapy, and other various classes that will help residents to succeed. The staff at Paradigm Shift, like I said, they will be people who are in sustained recovery. So all our peer recovery coaches, case managers, mental health therapists, and substance use therapists are all going to be highly vetted. Back to Caitlin. Best teachers are those who are living proof that it can be done. Now, I'm one of 25 years in addiction. Now here I sit, somewhere I didn't ever think I'd be. Kind of left that empty right now because I'm still working on this. And then the structure of it, executive director, financial manager, substance abuse, mental health, peer recovery, residency manager. Like I said, still working on all this. It's one person. I work 67 hours a week at a shop. So this is like my part-time stuff right now. And then when I spoke with the commissioner in November, she asked me if programs that I know like this that work. Unfortunately, I could only think of a few that actually, you know, have the same kind of structure and stuff implemented in them, but they all have pretty success high rates except for Stout Street. And Stout Street, I think a lot of it is because we get done with the 2-year program, you don't graduate until another year afterwards. How many people actually come back after being there 2 years to graduate? So they couldn't give me a real definitive number on that one. And then areas of focus, recovery and absences, co-occurring disorders, life skills, employment, housing. And then our second area is family connections, rebuilding them connections with kids, parents, grandparents, community involvement. To me, a lot of people think of community involvement as volunteering. I think it is getting out there in the community. You know, going to a ball game, you know, getting a job, stuff like that. And then another one is assisted medical care, because a lot of people like myself in addiction have struggled with getting medical care. So we want to help them get medical care so that they can recover fully. We will serve referrals right now. So MJ, behavioral health, like We'll be taking referrals from all of them. If MJ was to send somebody to us, we would actually refer them to Longview to go through the treatment process first and then come to us. Same with law enforcement, they're referring people to Longview. Once they get done with Longview, we'd have a place for them to come and actually start building on their life again. Probation clients, a lot of them go to the halfway house for treatment and then they get out, they have no place to go. So we kind of want to provide that spot where they can get out and get on their feet rather than go back to that lifestyle again. The paradigm, we believe everyone deserves a second chance at life, but implementing a structured system centered around stability, recovery, and treating residents with love and compassion while giving them the guidance to needed to recovery. We hope to change lives dramatically for all those affected by addiction. And I did pull numbers on some stuff. Like I said, I'm a one-man team and I work a lot. So, but I do have numbers. I have looked at 2 buildings here in Fort Collins. One of them I think I included with it. This is that 801 South Shield that used to be the old Turning Point building and then turned it into a frat house, trying to turn it back in to a recovery center. Has space for about 50 beds, although I think that's a little much. I was looking more at 30 beds. It has deputies. We're gonna keep to get the layout of the building. Okay. So this is the first floor with entry. I included another drawing that had offices built in on the first floor for case managers, peer recovery specialists, therapists, stuff like that. This is a lower level, so this is actually a workout room, and then we built in classrooms. The bottom floor for when they have their classes, they have a place to gather and have them. Second floor I made for women. As you can see, there are quite a few rooms on it. I talked with Colorado Agency Residencies, found out what area I needed, the bathroom I needed, everything like that, so that this one actually fit the bill. And then there's also a third floor for the men. They both have different stairwells. The women can go up one side, men can go up one side. We kind of keep them separated. And this one kind of shows where I roughly, crudely drew in the offices, spiritual advisor and stuff like that. It has I don't know that I like the kitchen so much. It's more like my kitchen at home right now. But I mean, for the purpose it serves, I also drew in a door, separate the men and the women. And this one's just the third floor again, and the lower level where I drew in the classrooms, workout room, and a couple of rooms for therapists. This one is 4.75 million. The other building I looked at today was 900,000. It needs about 1.5 million worth of repairs. So it's kind of a big project, but to me, like being able to give them people that support and that help and that guidance is going to be huge in helping them recover. I'll take any questions anyone has.
Questions?
I have a question. So, how do you propose besides the funding here, to obtain that building?
So I've actually been talking with a couple other places like Colorado Health Foundation and other places about getting funding. I know there's bills coming out of the Capitol this session that are centered towards funding for that. So I've been looking at funding options for it.
And when do those grants open up? Do you have detailed information?
I don't have detailed information right now. I just talked to a lady that I used to work with down at the Capitol, and she's supposed to be getting me the information, so.
Marshall, first I want to say thank you for your service on this committee and sharing your story with so many folks and sharing with us and being your insights and your sharing your story and your experience is so invaluable for this community and for others. I know we're also looking at what the COAD's doing and kind of what kind of programming and funding that's there. And I had some conversations this afternoon. So I just wanted to say, I'm glad you're sharing these ideas because I think hearing from folks who have, like you said, provided hope, that have been there and been successful, I think it helps us understand what was maybe needed and some of these things. So I really appreciate all the time and effort and things that you put into this. I think it's something we should, be in these conversations and taking your feedback. So thank you.
Thank you.
Is trustee Mason still on? He was on there a minute ago.
Yes.
Yes, I'm still here.
Okay, good. We don't see you. I wanted to make sure if you had any questions that I called on you.
Nope, I think I'm good here. Appreciate it.
So following up on that last point, I mean, what happens if these other grants don't come through or that building gets sold next week? It's money happens.
Well, the one building, the 801 South Shields, actually has a lease coming up in May. But if I can figure out a way to get in there before May, I could take that lease. The other building has been on the market for like 2 years. So, and it's had some demo work, so I said I need about 1.5 million in work. And the funding is my next step, like getting the idea and around it was first, and then start looking at funding and getting everything situated for funding is my next step.
Would you be looking at leasing the first building or trying to purchase?
So the first building, they sent me a letter of intent for 30,000 a month for the first 2 years. And then pay off the remainder at the end of the 2 years, which is 4.278 million. The other building, they sent me a letter of intent and it was just for the 900,000. And I have, my broker reached out to Pat Stryker today to talk to her and her Bohemian Foundation about helping.
Just, yeah, so lots of information. Thank you so much. I echo the commissioners' thoughts about your participation and everything that you're doing. And this, a lot going into it, still seems fairly in the early stages
It
of
is.
development and everything. It's a little conceptual, but I know you've done some work and have some things kind of irons in the fire, so to speak. Do you have a particular ask of us for 2024
Support.
or just support?
That's all I'm really asking for. Like you said, it's in the early stages. And I've been talking with behavioral health and car and everything else, finding out what all I need, the licensings and certifications and everything before I start jumping into what do I need for funding. So.
Thank you.
All right. Yes.
If the committee, made a, some sort of promise of funding renovations, once a project comes through, is that something that would be helpful or meaningful to the project as opposed to, upfront money for purchase?
Absolutely. Like if I can get things going in the right direction and down the right path and the committee did decide, hey, we want to help with a little funding, absolutely. Like, cause I know when I talked to Colorado Health Foundation, they told me like, we'll help pay for administrative costs, we'll help pay for peer recovery coaches, and stuff like that. So like some funding I know of, but I'm still working on the rest of it. But right now, anything helps. Even like I said, just support. Trying to pull my shop along at the same time while I pull this with this arm. So a little bit of a chore.
Well, thank you, Marshall, for your presentation. What I agree with Senator, would it be like every quarter or something, or anytime there's a big movement, boy, we'd love to have an update and know if, how's it going, and if there is a request or an ask, that'd be great.
Yeah.
All right, we're at time on this, so I'm gonna move us along. So
Thank you very much.
So thank you for that. All right, moving to number 5, we have 5 action items here, so Carol Block's been very busy, our treasurer, on our fiscal representation, so I'll turn it over to Carol.
Right. The first item is the expenditure report, and I don't know, Caitlin, if you could possibly bring that up for us, but it's also in your packet with tiny print. So we have 2 primary reporting responsibilities to the COAC, and the first is to come up with a plan of how we're going to spend money based on the approved uses that the COAC has established. And this council has done that. And the second thing is to report expenditures this year by February 9th against those specific categories. And so what this report is what I'm planning on submitting on behalf of this group, unless you have any changes or additions. The important columns, poor Tommy's reaching for his glasses. I think, yeah, glasses should come with this. The most important column is this group over to the right-hand side. If you look at the column that says budget, that is the plan that this group has approved for the first 2 years, for 23 and 24. And then next to it is what we've actually spent. And most that expenditures occurred in 23. And then the next column is what we've committed to other grantees. And then the last column is unallocated. So I need to submit the budget and also the actual expenditures to the COAC. I did want to point out one thing. There's been some discussion about using funds for data collection, maybe a data dashboard, data analysis. And that's not currently an approved use that this council has selected. There is an approved use for that. The state will allow you to fund that approved use if you would like to, but you just need to make a decision to move funds from some pot to that pot so that you can spend them for that purpose. So you might want to move those from administration or whatever you'd like. But for right now, we haven't allocated anything towards data collection. So this is what I'm planning on submitting on your behalf. We also have to submit names of our vendors and dollar amounts, and that information is public information. It will appear on the Attorney General's website for this project. So if there are there any questions?
Carol, as always, thank you for how you lay it out. It is so easy to.
Yeah.
It is. I do have a question. For example, our school-based programs, we earmark the same amount for 2024 as 2023. I do believe Mr. Riggs is going to say that they don't need all 400,000, it'll be 300,000.
Right.
Is that something we have to decide now, or can we change that March some other time based upon just things change?
We can change. So every time we make a change, we need to submit that to the state and they have to look at it and approve it. So we could change it every week if we wanted to, but it's a lot of work for us and for the COAC. So I would suggest kind of bundling your changes and maybe doing an amendment in June or something like that.
Thank you.
For example, with that extra $100,000, you can just leave it sitting in that use, and then maybe you want to move it to data collection or something else.
Okay, boy, that's great. Thank you for that clarification. Any other questions? Making sure online I can see. Thank you for setting it up that way, Caitlin, I can tell. So this is an action item, am I correct?
Yes, if you would please approve this report for dollar.
I'll make a motion to approve, Larimer County or Larimer Regional Abatement Council, Opioid Abatement Council budget.
And expenditure report.
And expenditure.
Thank you. I'll second.
I got a motion and a second. Any further discussion? See that, does anybody oppose this motion? That passes unanimously. Okay, next one.
Okay, the next one is quite short. This is the administrative costs for this council for July through December of 23.
Is that June or July?
It's June 30-ish,
Okay,
July 1, actually.
okay, yep,
So it's for the second half of the year, basically. And that's Caitlin's time, my time, David Aero, and some other sort of assorted administrative costs. And they go against that administrative cost approved use that the council has approved.
I have to say, for 6 months administration, that's a low number, so. Yeah, very good. All right. Any questions on this?
I just want to thank everybody for their time. I agree too that I'm not sure that all of it is included in these figures, so thank you.
Need a motion to approve this so we can pay it.
I'll make that motion to approve this.
We've got a motion to approve. Is there a second?
I'll second.
Thank you, Aaron. Any further conversation with the motion and second?
Should we also look at this bucket for potential data collection
Sure.
and reporting?
We'll have to move it, right? Yeah.
At some point,
Yeah.
yeah, I'm just thinking of even the work that Dr. Olson, Jared Olson has done, and I think one more of that future potentially, but we'll talk later. Okay.
Yeah, that admin bucket is pretty generous compared to what we've spent thus far. So that would be another place to move those funds out, depending on what your future plans are.
Great question. Thank you. All right, anybody oppose the admin costs? Seeing none, that passes unanimously. On to the next one, Carol.
The next is really more of a question. Last month, this group approved lived experience stipends, but it was left unclear as to whether that stipend was for 2023 or if it started in 2024. So that's what I'm coming back to this group for, is direction on those stipends.
Yes, you were the one that made the motion, right?
I actually didn't realize that that would be a possibility. If it is within the rules, as the person brought it up, I would like it retroactive for 2023 if that's possible and their support.
Any other thoughts?
I would support that as well.
I would support that retroactive.
Thank you.
I make a motion that we make the stipend retroactive to 2023.
Second.
We have a motion and second to make that retroactive 2023. Any further conversation? Hearing none, does anybody oppose? Don't see, so that passes unanimously. Good, all right. Next item.
The next item, at last month's meeting, this group approved second year funding for NCHA and NCHN. And included in your packet are those grant agreements, those amendments for both of those agreements. And I think one is 650, the other is like 500 or something. But anyway, as a group, you've approved this funding, and these are the agreements that make that official. So I guess we would need a motion to approve those, or if you want to spend more time looking at them and approve them next month, whatever that's your choice.
Chair, motion to approve the amendment to the NCHA grant agreement for the second year funding. We're taking it individually, is that what we're doing?
Yes.
Okay, I'll move with that one.
there a second?
I'll second.
Brian's a second. Thank you, Brian. Any further conversation? I just disclosed that I currently serve on North Colorado Health Alliance Board. In that capacity, I feel it's best that I refrain and abstain from these votes, just so there is no preference of a conflict of interest. So I will be abstaining, but support their work for sure. Any further conversation? Okay. We'll take the vote on that motion. All those in favor? Any opposed? I abstain. That passes with 5 votes yes and 1 abstain. Okay. Now the next one, the amendment to NCHN.
Chair, I'll make the motion to approve the NCHN grant agreement, approve the amendment to the NCHN grant agreement for the second funding. Second.
Got a motion and a second by trustee Youngland. Further conversation? Seeing or hearing none? Anybody opposed? Seeing none, that passes unanimously. All right. Anything else?
That's all I have. Thank you.
Hey, we got through that. Good job. Okay. Over to you, Commissioner, on ROAC Data Analysis Subcommittee update. Perfect
Great.
timing.
Thank you, and I appreciate everyone's patience. I actually got through both bills and testimony, and since they were kind of my amount of my work last summer, I really appreciate everyone's indulgence, so I needed to be there. Hopefully the second one gets passed through any second. So we have met for the second time as the Regional Opioid Abatement Council Data Analysis Subcommittee, and I want to thank Beth and Trustee Mason for their work and their attendance, and also Laura Walker and Caitlin and others, and Dr. Gerald Olson. I thought I saw him. There he is. And Taylor from BHS for their work, and we had a really robust discussion. And so we have come up with an idea. We do think there is a strong need to collect all this data. We feel there's this about over 24 data sources that we think we can collect data from, including maybe encouraging law enforcement and others to change some of the data collection on Narcan deployment in the field, either by family or law enforcement or ambulance, because we currently don't do that here in Larimer County. Weld County and Boulder are doing that, so we're looking to that, how we can influence, recommend that. It seems like that is something we all agree on. We're just trying to figure out what are our next steps, and I appreciate that's extra context to do that. And then we're also appreciate we're looking to possibly come and recommend some administrative costs, because we've asked Dr. Jared Olson and Taylor from the Behavioral Health Services team through Larimer County, who have experience with data and grant management, to help provide and bring all this data together. We can show the sources to create a dashboard for us as our regional opioid abatement council, to show for us to track how the impacts of these grants, but also for us to look how is it looking conditions and how we're making a difference in our county. So we are going to not meet in February as we give Dr. Olson and Taylor and Laura Walker and the health department a time to pull this pilot dashboard together, and then bring it back to the council and discuss next steps. And I'm hoping the council will be favorable and consider as we bring those costs to reimburse the county for those staff costs after we understand how much time it's going to take. And I appreciate Dr. Olson and Taylor taking a lot of capacity out of their work for the county to help us with that. Today I was down in Denver. That's why I'm a little scared. I was down in Denver at the Capitol, and I'm up here to testify. And I talked to a couple other folks who are in regional opioid abatement councils and other groups, and they approached me because the state's COAD, the Colorado Opioid Abatement Council, is looking at this too. How we how they want to track data. And they've asked me to join that meeting on February 9th. And so I had told them that we were kind of already gonna have these things and we were doing this dashboard, and they're very excited because it sounds like what they're hoping to accomplish is what we're hoping to accomplish. So they're kind of anxious to see what we come up with. But they just want us to stress, we'd love to make sure it's portability. But I also said some of this was for how we felt as a council we needed to. So there's another connection there. So if there's any objections, since I've been invited, I'm hoping you all support me going. I will be in DC for the legislative council for counties. And if people charitable trust on the resiliency, but then I can step out and do that meeting. So so that's where we're at. We do think there is a strong need for us to collect this data, get a feel for what's happening, and for us to measure how the grants, for us to have that data measure how the grants are effective. And then I'm looking forward to see what this looks like. So that is our recommendation. And then we will have all that for us to look for at the council at the March meeting, if that would be okay to put on the agenda. And then we can take steps forward as a council after that. So I'm open for some questions. Any questions, concerns? Go ahead.
I think it's great that you to be included in the statewide discussion too. And I hear what you're saying about each council kind of having their own, but also I think consistency from the state and across the different regions would be great too. So.
And I think you're right. So I think there'll be that is be consistent. I think what we're talking about is the same, but also we're tracking our own data for us to look at others having our own kind of thing, looking at how our grants are, because it may not, because other ones have like recurrence, but I think you're right. And I think they're hoping for that consistency or that standardization of certain things. So so yes, I agree. I think we need to wrangle all of this information as best we can for us to be informed and for us all to share. I think there's some great information from the regional drug task force and others, and it's there. We just have to bring it together. I can't think enough Taylor and Dr. Olson taking this on and helping us.
One of our grantees in Jade brought up a question about this, so in Jade,
So for 2023, we actually subcontracted with Butler to support the development of baseline data, really. And Dr. Olson was a part of that as well. But for 24, there was a re-up of those funds to continue with evaluation. And so I would just suggest that we make sure we're working in tandem so that, Butler can be leveraged as a resource for that work as well. And carry forward the evaluation that's already started. So if that works for the council, I'd be happy to look at our existing scope language and make revisions as needed.
I certainly think we don't want to create the wheel, but also just trying to figure out I think we're just trying to look at all these data sources and figure out how we pull this all together. So
yeah, and Butler is the evaluator for our post-law data already, and also for the jail mat program, and I'm sure those are data points of interest. And so since they're already a conduit of that space, that is probably in alignment with what you're looking at. And additionally, part of that scope as it's written is to support with the grantees of this council with evaluation too. So
I think it's welcome to have that come into the conversation. It sounds like Dr. Olson's already there listening, so I think it's certainly something we should consider. So
absolutely, there are certainly data sources that are available to me that aren't available to Butler, and vice versa, and save those for together VHS. I think we need to get it. I see that.
And I would say that's kind of where I'm at, is that we have I think we have all a bigger scope to kind of pull all together, also to make sure we're not being repetitive and making sure we understand what we're going to do. That there's the silo that we'd love to have that all come together. So I look forward to it. So I think I'm really excited, and I'm really excited to be asked to join.
Yeah.
So
Do you have, has there been, because we'll be discussing this later, but is there any thought of what kind of funding perhaps we need to be looking at to facilitate, and pay for this time?
So it probably be out of the administrative costs because it's kind of administrative, and so I know Laura's helping track that, and that's why we was probably, there's some capacity now that, staff can take away from the findings and focus on this. And so I think that we'll probably come back with some of those costs, probably end of February or in March for sure. So that we have a ballpark, so we would know what we might need going forward. Because right now it'd be easy to say, hey, we probably might need a half-time person or.
Yeah.
But also we've had this discussion, as I think I brought up last time in December, that, was it in December? I think I brought this up, that we thought there might be one person, not law enforcement, maybe just a staff member. We're looking at that need, and I think that, Director Gonzalez mentioned other counties might have this. Or councils, someone who is kind of, neutral or is in house in one of those committees that goes to maybe the drug task force meeting or goes to this other meeting or comes and reports to us. It's kind of high level that can be kind of a neutral, objective kind of group that comes and brings all this information and helps us collect all things opiates. That, we all can't be there at once and we're trying to bring this all together. So that might be something as well that can connect all these dots for us and bring that back. So that's another suggestion. I'm not sure what that looks like. And I think you mentioned there was couple other regional opiate things or something that has a similar kind of position. And so it's not, there's other, maybe except parts of things we peer at.
So March is where we'll have a little bit better idea of the funding that we may be.
Yeah.
Well, it's under administration on Carol's.
Right.
You'll see that there was 186,000 earmarked last year. We're gonna spend about just under 30,000 in 2023, right? And then we put 339,000 in there. So that hopefully that's plenty to do this activities, which I appreciate, Commissioner, you're doing this. We want to make data-driven decisions. I think that's really important to this committee, and that come from the very beginning. So this is really a real good mechanism for us to do that. So thank you.
Right time.
Okay, thank you.
I appreciate the support. It's
Yeah.
very exciting.
Thank you. All right, moving along to Colorado State University's 2024 funding proposal for our prevention programs with our youth. So I'll turn it over to Mr. Nathan Riggs.
All right. Hi, everybody. For those of you who I haven't met, I'm Nate Riggs. I'm the Executive Director of the Prevention Research Center at Colorado State University, and we were one of the grantees from last year. So what I'm going to do today, and what I'm really excited to talk about today, is our proposed plan for year 2 of this school-based work in opioid prevention. And so what we do, we're working really far upstream to prevent eventual opioid use, substance use disorders or problems. I will tell you that the schools are super excited about this scope of work. We've been working on planning for this last couple of months. And I think you'll see that this is a nice combination of sustained support for the initiatives from last year that were working really well, as well as some new additional stuff that we're going to be able to do that's more district specific. So last year, partly due to capacity and partly because we haven't collected data yet, the scope of work was identical across the 3 school districts. So this is Poudre, Thompson, and Estes Park. This year, because we know each other and we built relationships and we collected data as part of our first goal from last year, we know what are the gaps. Both our center and the school districts know what the gaps are in prevention. And so we're able to really create more district-specific precision approaches than we were able to last year. So just as a quick review, the first goal last year for our project was to conduct a district-wide scan of the existing prevention efforts. We wanted to know what's going on now well, and what's evidence-based before we start monkeying with the system. So we went in, we collected a lot of data. Those data informed these 2 subsequent goals, and then is continuing to inform our proposal for year 2. The second goal from last year was we pretty much knew that there was going to be a need for professional development around prevention in schools. Teachers aren't trained to implement prevention programs. So we wanted to create professional development opportunities for those teachers, those staff that are going to be implementing prevention programs so that they do it as effectively as they possibly can. And then the third goal was we knew that we wanted to actually reach kids in the first year. And so we identified an evidence-based, the most evidence-based substance misuse and mental health promotion program that is out there. It's called the Blues program. And so we started implementing that this spring, just a couple of weeks ago, across all 3 of the school districts. So we're really excited about that. And all of this has informed our proposal for year 2. This is, so these are the ideas. The scan, again, really informed what we're going to do or what we're proposing to do. The first is to continue to support the effective implementation of the Blues program. So now that the teachers, the implementers are trained up to implement it, they're starting to implement it, continuing to provide them technical support and training and to do it right. So what we're proposing to do in year 2 is to continue to conduct these learning communities where the implementers can learn about successes and challenges that their peers are having. And then we can provide the technical assistance to help them through their barriers or their challenges for implementation. Each of the school districts also are going to, we're proposing to have them tweak it in district-specific ways that we'll talk about in a second. A second goal for this year is to elevate and advance the professional development beyond kind of beginner level training and technical assistance for or professional development around prevention to more intermediate level to continue to increase the capacity for these facilitators to implement programs effectively, not only the Blues program, but other programs, including the ones that they'd like to implement in for goal 3. So this goal 3 is really where we're going to work at a district specific level using the information that we gathered from the district scans in year 1. So I'll talk about those as well in just a second. All right. There we go. So here's the Blues program. It is a cohort-based program where youth who are identified as being at risk for substance use participate in an 8-session program that focuses on motivational interviewing and things like that. And we trained 35 district staff last year, 11 peer support facilitators, and those folks are starting to implement programs and get their implementation fidelity certificates from the program developers and proceed along the process of becoming a trainer of trainers. So then they will be able to train other district staff to keep sustainability of the program going. So for year 2, for year 2, I mentioned this stuff here. We're going to help them evaluate the program. The 3 districts are going to tweak it in some ways. Thompson School District's really not planning on tweaking it, but they'd like to have another round of training so that they can train more people in their district to increase capacity and reach in Thompson School District. Estes Park is really wanting to work with their cultural liaisons so that they can implement this program for Spanish-speaking students in their district. And then PSD, and this is going to be a recurring theme, they really are invested in working with their LGBTQIA plus identifying community of students. And they would like to run some Blues program cohorts specifically with folks that queer identifying community in their school district. All right. So the second goal, we had proposed, I think last year, to do about 4 hours of synchronous professional development. The school said, hey, we would rather have asynchronous opportunities where our staff can take this professional development when they want to, when it's convenient for them. So we started a learning management system. And Caitlin, if you don't mind, would you mind clicking on that link real quick? And then I'm just going to quickly keep an eye on the time. We created is that not? Okay. So educators, this is actually open access. Anybody can participate in it. I encourage you all to go to this and learn more about prevention. So we enroll teachers at, or facilitators, it's actually all school staff, in prevention science courses that we build, modules. There's about 10 hours of content here. And it goes from really kind of introductory, what is prevention science, to understanding risk and protective factors, implementation science. Some of these things are more around like prevention grant writing for educators. And more stuff about youth prevention work and teacher social emotional learning and wellness. And so we're proposing to continue to build this out so that programs that are implemented in schools are implemented well and effectively for maximum impact. All right. So each of the school districts have given us ideas for what they want for this professional development, and we'll be responsive to that. I won't go into all these, but here are some examples. Okay, so that's goal 2. And then goal 3 is where we're really getting into, oh, you all can read that, I'm sure. I've had issues with this is even worse. But this is again taking data to inform decision-making for year 2. Poudre School District took a look at their Healthy Kids Colorado survey. And what you'll see here is this is gender identity, and sexual orientation. These highlighted cells right here are rates of substance use for those youth who identify as genderqueer, transgender, bisexual, and gay and lesbian. And in many of these cases, these rates are double, if not triple, for the queer community, queer identifying community in Poudre School District. I'd be surprised if it was much different in Thompson, Nessus. So another example of where we're using data, and then they looked at the scan that we conducted last year, and they said, hey, we don't have any programs for these youth. And so we looked at these evidence-based registries, and maybe not surprisingly, there aren't many evidence-based programs that have been developed specifically for LGBTQIA students. So what we're going to do is what we're proposing for this goal 3 across the districts is a planning period from right now, basically, until the end of the school year. And in this case, we would identify, select, and adapt either existing programs that we think can be adapted for the LGBTQIA students, or we are going to co-develop substance use prevention programs with the youth, like media campaigns and things like that they can participate, and it can be youth-driven. And so, yeah, so that's Poudre and Thompson. They identify a lack of resources for youth who are already starting to use substances, but maybe don't have a substance use disorder yet. And so what we're proposing to do is to use that planning period starting in March to work with the school districts while they're in session, while they're there, right? And identify programs that are evidence-based for that population of youth who are already starting to demonstrate some, and we're trying to prevent a full-blown substance use disorder. And then Estes Park used their scan from last year to develop a 5-year plan for prevention, which we thought was pretty cool. They did that. It was really nice to see. And what they identified was that in addition to the gap that the Blues program is filling for youth who are at risk, they didn't have any programming that was universal for all youth, regardless of their risk status. And so what they proposed, what they would like us to work with them on, is implementing social and emotional learning programs from kindergarten through 12th grade. And they identified one called Second Step. It's an evidence-based program to implement in grade schools, in their grade school classrooms in the spring, and then come next year, implement versions of Second Step for middle school and high school. And then what we would do is we would help them, give them implementation support, evaluation support, and we'll coordinate all of trainings and all that kind of stuff that goes along with it. So that is the proposal. I will say, the last conversation that I was a part of, the idea was to fund year one projects at 75%. So I went with that number, the 300,000. We could do more with 400,000. I don't know how procedurally that would work or not, but just wanted to put that out there. There was stuff that we talked about with the school districts that we had to leave on the cutting room floor, so to speak, because of the 75%. But I guess that could be another conversation for another time, or how that works is how it works. So I'll leave that open for questions then. Questions? Yeah.
This is fantastic and really wonderful to see it. All three districts have been really engaged and coming very innovative, and certainly thinking that there might, I see that also there might be other things like behavioral health too, that, you know, their grant cycles open up just to make sure they understand there's other opportunities to kind of support that. Long term, do the school districts feel that if they start implementing these really needed and programs, do they see any kind of pathway to sustainability in the long run?
So programmatic, yes, there is. With the professional development pieces to it, those are online, our learning management system, open access, they're there for good. Once we create it, it's there. The program implementation, the third goal, we're trying to identify those programs that have built-in pathways to sustainability, like the Blues program. It has the trainer of trainer models. Not all of those programs do have that built-in stuff. So that's where, you know, we can come in and provide that sustained training and technical assistance. But for the most part, many of these programs are sustainable long-term. There are the training costs that are upfront, some cost for materials, but really, once that's covered, that's it. And so, yeah.
Great. You know, also was curious, when you talk about other, you know, programs, I know the Connect Effect is connected through and I don't know how that, I know we've tried to get up, and I do have an extra post on this page, I'll get that before the meeting. I'm wondering how that is connected and how's it, do they understand about that and how that's connected? That also has kind of youth-led or youth engagement, so just curious about that.
Yeah, that's an excellent point. As an aside, we are working with Kent and the Connect Effect on another proposal in another region. And that could be something that maybe with the some other funding, that we could work with them on doing that in Larimer County. So what we proposed in Region 16 was there's a rather extended data gathering and planning period for their RFA. And so what we're proposing in a couple of weeks is that while we at the PRC do this really deliberate working with school districts that takes time, that they're planning to tailor the Connect Effect messaging to El Paso County and Teller County. There could be something similar that we do here in Larimer County, because the Connect Effect as it currently exists is a one-size-fits-all for the state, which is great, but it could be more precise and tailored to counties and regions. And so that could be something that we already have the template for it in the proposal for that region.
Yeah, I'm really aware, but the other activities you're doing, I just got done hanging out with all the different commissioners and we were talking about it because we all know what committees we're on.
Okay.
So I think that'd be great, because I do think there's some extra funding with the Connect Effect too, and I think that's an opportunity there. So I appreciate it. Thank you.
Uh-huh.
I believe at time.
Okay.
Proposal is year two, $300,000. And thank you, Nate, for that wonderful proposal. I do have a motion.
I'll second it.
Go ahead.
I'll make the motion to.
There's a motion, there's a second. There's a second. Any further conversation?
We just love the program. Thank you very much.
Absolutely.
I agree from a public health prevention perspective, this is perfect. It really bringing our superintendents, health department, and Jared, data, you and your team. It's been very, very successful, especially with the youth mental health task force and the summits that have been going on. And Cooter School District has put this as one of their top priorities for strategic plan. Great, it all comes together.
One last thing,
Yeah.
and knowing that the amount in the school-based prevention programs has we still have the formula, and we haven't allocated the additional, you could always come back with another proposal, anyone could, but I just wanted to, I know you mentioned going down to 75% as was the idea, so.
Yeah, okay, I'll connect with it, with how.
Good for you, yeah.
Yeah, okay, great, thanks.
And I encourage you to look at other funding opportunities throughout the county that should be.
Yeah.
Thank you for all services grant that opens up in June.
Okay.
More information will come out.
Awesome, great,
Thank you.
Taking notes.
Listen, yeah.
great, thanks.
All right. Got a motion. Anybody oppose that motion? Hearing none, that passes unanimously. Thank you. All right, moving on to number 8, our housing and social connectivity programs. You recall, we really had some great discussions that were led by some facilitators. We identified housing and that social connection is so vital, part of the whole process, getting to recovery. So we have 3 organizations that will provide us presentations and a request based upon our funding strategies. So I'll ask Abundance Foundation come up first.
Thank you, guys. This has been some good stuff. The education sides. That's awesome. So for those of you that don't know me, I'm Brian Bauer. I'm the founder and executive director of the Abundance Foundation. We do recovery coaching and sober living in the Fort Collins area, so peer support. I'll try and keep it pretty simple. So I don't make complicated PowerPoints with a whole lot of info. That's not my wheelhouse, technology and stuff. So the way that this cycle works is the clients that we get are all Medicaid clients. So everybody's coming out of some place where they don't have access to financial resources overall. So that would be something like jail, prison, detox, other treatment centers that take Medicaid clients. And so right now we're actually approved treatment providers for the Department of Corrections. So we're in with probation and with parole, and we have access to be able to communicate with people prior to their release. So that's been a huge referral source for us. So the thing is, when they get out, the main struggles that they have is really the hierarchy of needs, right? They don't have any money, they don't have housing, they don't have employment, and they don't have connection to community. Now, if they have a felony, that makes it even harder. They can't get a job right away, typically. They can't just go rent an apartment. They can't even really rent a room at that point if somebody does a background check on them. So they're facing all of those things, but typically people know in that community, they know how I can get money, where I can stay, and what I can do to survive. And all of those things are the repetition of that same cycle, right? They might be able to pull it off for a while, commit a few more crimes, do whatever they need to do. Typically the cycle repeats itself in that gap. So what we do is meet with them prior to getting out. We try and sit with them with other case managers like through Coleslaw, and work with them while they're on the inside to be able to establish a warm transition period when they get out. So they make connections with one of our recovery coaches, and then we get them into one of our sober living houses. We have a men's and a women's sober living house in Fort Collins right now. And so what we've been able to do is use grant funding to be able to scholarship them into our housing on a sliding scale basis. So they come into our housing at 50% the first month, they get 25% covered the second month, 25 the third. We're flexible on moving forward past that while they're meeting with the recovery coach and meeting all the aspects of our program. So they have to be doing a 90 and 90 12-step meeting. They have to have a sponsor in the 12-step program. They have to be meeting with their recovery coach 3 times a week. They have to be doing UAs through the sober living house. They have to be going to the house meetings. They have to be fully employed. So that goes on to the next piece of it, right? So our coaches will meet with them and establish with our clinician their treatment plan goals. So they have 3 treatment plan goals that are established at the beginning for their first 90 days in our program. So the big thing in that is connection to sober community. That's always one of those 3 goals on there, is to focus on that. But typically those other goals are something like meet with their probation officer however many times a week, 2 times a week, get their driver's license back, make their dental appointments, all these type of things. And so what we also see then is in the same places that there's the relapse on that first section, when you get to the second section, what happens is, say somebody goes to the DMV and the DMV is like, you need these 2 forms to get your driver's license. They only have one of the 2 forms. They sat in line for 4 hours and they're like, I can't do this. They leave the DMV, they go to the liquor store. It's not, these spots of relapse and recidivism are not these like major catastrophic events. It's these things where it's like, I just don't know how to do it. And I'm coming from an environment where nobody ever showed me how to do it. And nobody ever sat with me and helped me fill out the paperwork. And so I know how to do all of the things that repeated the cycle. And a lot of our clients are coming from family systems where their entire family system is also that, right? Their entire family system is mom, dad, grandma, and grandpa. Everybody's done prison time. Everybody's a drug addict across the board. And so if they're coming from that environment, they've never even been exposed to like what a healthy life is. It's like, well, why can't you just go get your driver's license? It's like, I've never even been inside a DMV, so it's not even real. Like, it's not even like, we see it's like, oh, I just go to the DMV. I just go down the hall right here. Go sit in line. Like, that's not even like a thing. So the coach sits with them at probation, does advocacy when they have to go to court, meets with them and their doctor to figure out what their medication plan might look like, does all those things, and then helps them find employment. So we're connected with like local businesses and whatnot that will hire people with felonies. So we're able to get them into somewhere where they're fully employed. There's a lot of programs in the area that they can go back to school for, where they can learn a trade. So we try and get them into something, at least something, just employment in general at first, but really start moving them into like a career-oriented direction. So we get them doing that. And then because they're in sober housing based on a scholarship, and now they're fully employed, they're able to start figuring out what budgeting looks like. So now a lot of their basic needs are all covered, and then they're able to start budgeting for what it looks like to get to a self-sufficient idea, the self-sufficient lifestyle, right? So then they're able to get to this place where it's like, okay, a lot of our people are coming from situations where their kids have gotten removed from the house. So now it's like, okay, what do I need to do here to get my kids back to be able to live in my own housing? And so here they're meeting with child services, DHS, everybody else. They do all the things that they're supposed to do from the court. They're able to budget, and then they're able to get into some type of housing environment, typically with other people who are in the recovery community that they meet here, to be able to get into stable housing over there. And so the idea is like, if they get all of these places, then we're starting to break the cycle and actually get somebody to a place of purpose and hope and self-sufficiency where they have the skill set to actually go out on their own. And so a big part of the thing, sober community-wise here, is activities. So we do, excuse me, we do weekly sober events. So like this last week, we did a bowling activity. So we took everybody out and went bowling. We had 25 or 30 people show up to bowling. They did laser tag last week. We do camping trips in the summer. The women do, and actually the men now too, do the ERT and STIRT programs, have this dance program that they do actually inside the prisons. And now they've been able to get that out so people in those programs can meet with our coaches and our community while they're still in those programs and do this whole hour-and-a-half long dance routine. And even like all the men that are in prison right now are actually really involved in it too. So it started on the women's side and it's gone to the men's side, and it's had probably a bigger effect on the men's side almost than on the women's side, it seems like. They're actually doing it right now. I'm here and they're dancing. I got out of dance to come here today. But yeah, so that we have people that are teaching, we have a studio space where people are teaching yoga classes. We actually have one of our clients who is certified to teach yoga, who's been teaching, Jake is teaching yoga. So he's been actually running groups once or twice a week for people doing yoga. We have trauma yoga instructors come in and do their services sometimes, just donate that time. We've done equine therapy. We have an equine therapist in the area, as long as we can kind of afford these 6-week-long programs to be able to work with her. She works with us on funding to be able to do that. And really, it's just about creating a whole lifestyle, right? It's like they come to us and it's like, here's just how you do life. And here's not just how you go to meetings and focus on just recovery. It's creating and filling all the gaps in creating a whole self-sufficient lifestyle. And so I guess you could go on. I have some data that I started tracking. This is drug of choice. The next one, that's some basic gender data, age ranges. So you can see kind of what our main age ranges is. This started we started here in the end of 2021. So it's really 2 years worth. And this has been like manual data by me mostly. So it's not I don't have a true data collection system yet. I'm actually working on that through the software system that I use for people to apply to the program. There's a way to create alumni surveys. The problem kind of in like the catch-22 with what we're doing is we want people to get to self-sufficiency. And when they do, they're still kind of connected, but they're also really hard to get a hold of because now they're living these lives. And it's like trying to get them to respond to get the data points on all the follow-ups. It's like, yeah, your life is so great, but we need to know why. So we're trying to do that. So this is the current data that I've pulled out of it. 67% employment rate, 12% unemployed. We have a couple of women that are stay-at-home moms, 3 on disability. 21 is that unknown group. 45 is now self-sufficient. 28 sober living. 4 is homeless. 23 unknown. 1 client is all that we know as far as recidivism rate right now. So we have less than 1% recidivism rate. 70% sobriety. 30 is the unknown. I would say that a lot of that is mostly not sober, but I don't know because usually somebody will turn up and they might be in jail or they're back in detox and then they come back around. So that could be that. Our 90-day treatment plans. One thing about it is they can do multiple 90-day treatment plans. So they can do it back to back to back and be with us as long as they have Medicaid. One thing we're running into right now is that Medicaid is dropping people. We were doing really good on that end of getting Medicaid on that COVID run, where they were just like letting everybody still have it. Now they're dropping people quarterly, it seems like. So that's going to be kind of a different thing to mess with. We've had, so I went through how many people like receive services that applied. We had a lot of people that would apply and then not actually follow through on anything. So we had 3 out of 4 that were doing that. We do refer people to a higher level of care. Some people come to us and there's like severe mental illness that we can't do or whatever the situation is. And we've had to refer people out for that. We've had 2 clients that have passed away. Neither one of those was from overdose, fortunately. So there is that. It was different circumstances, but we have had that.
Brian, we're almost at time. So
okay. Yeah. So again, this is just, cost proposal. So average cost per client, $1,206 is what we spent on per person. The $5,700 is the typical average for 30-day outpatient programs. And this is what we're asking is the $300,000 for housing, because we're able to do 23 people. It would be more than 23 people, but the idea is like 23 people over a 12-month time span. So everybody's really on 90 days. So it's like different groups of 23 people over 90 days over the course of a year in sober housing.
And then the social connections is the 250,000. I have the breakdown of that on what it costs for programs to be able to bring into the jails and prisons, which is the R1 learning system, the health and wellness memberships that we have at the gyms, equine therapy, weekly activities. It's for 250. Apparently on this Excel spreadsheet system, it calculated indirect costs at 37,500, and I don't even know where it came from. It just like calculated that on its own. So that's not actually part of it. If you want to give me another $37,500, I'm not going to complain, but the ask is for the 250. Was there any questions?
Questions? Is it exclusively for reentry from jail or prison?
No,
Okay.
no, it's just, that's been a good one for us because they're coming out of, as a good referral source, and we've been able to get one handoff through it. But we have had people come from detox centers. Longview's been a really good one now because we have a lot of connections with Longview. So they can go into Longview for the detox, be there for X amount of days, and we can actually meet with them in Longview prior to them being released. So we can kind of do a handoff from there too.
Yes, Mr. Chair, thank you. I appreciate the presentation and grateful that you are finding our Lerma County Behavioral Health Services Longview campus helpful. That's great. You had mentioned in the previous thing that come before about being able to expand to doing more of a women's house or have a place exclusively for women. Is that part of this proposal? Are you able to expand that with this money?
Yeah, so right now our women's house has been consistently full for basically the majority of this last year. Like we've been continuously on a wait list, and because it's a smaller house, there's 6 beds in that house. And so we'll be able to get, with the funding, we'll be able to get additional housing that we'll be able to fill with people that are getting the grant funding. Specifically, the women's house. So we got the women's house, then we open a bigger men's house. So the next one would be another women's house.
So piggybacking off that, it's a great question. Under the housing, for that's unclear, it's a $300,000 ask. And that is for those monthly housing and stipend and silver housing.
Yep.
Is that to any house, or is that a house that you guys have somewhat?
It would be primarily for ours. We have had some people in other, if we're full, like if we can't get people into ours, then we do make exceptions to get people into other housing at that time. That's because that's how we started, was by doing it to get people into Oxford houses and whatnot when we didn't have our own houses up and running yet. The difficulty is that we don't have control over those houses.
Right. That's
There's a lot of accountability that was left on the table that we can do on our own, can do.
So just to clarify, because the women's house is so small, the housing fund portion of it would not be to expand that. It's just to go to the general housing fund.
Well, I can go buy another house. We don't have the money to scholarship people into it. Like this wouldn't go towards the purchase of a house. It would just go towards funding people into it. I can get another house up and running next week. I don't have the grant funding to get the people from jail into the house.
Okay.
Well, that'll be our last question.
Actually,
Oh, I'm sorry. I did not see that. Trustee Black or Councilperson Black.
That's all right. Thank you so much. I'm wondering about transportation services. Does your organization provide any transportation services for your clients?
Well, I mean, the recovery coaches they're basically the transportation service also. So the idea is if people are eligible to get their driver's license back, we're trying to get them as mobile as possible quickly, and to also be able to use the services that are available. So we want people to be efficient at being able to use the bus system, being able to, the wages program actually gets people the scooters and those type of things too. So it's getting them connected to the ability to be self-sufficient and mobile in that way. But yeah, for that first, basically the 30 days at least that they're with a recovery coach, our coaches are just driving them everywhere they need to go.
Oh, okay. Thank you.
Thank you. What are the Larimer County residency connections of the population? You get percentages in that?
I'm not sure what.
Like if you're getting people from jails and prisons, I mean, are we talking about just LCDC? Are we talking about?
Oh,
If folks are coming from prison, what are the Larimer County?
It's just Larimer County right now. So we've actually just got accepted to go into Weld County. But I don't have any coaches working in Weld County. So we can go to get people in Weld County and bring them over, transfer them over to Larimer County and get them into our housing and connected to our probation officers and whatnot. But as it is right now, it's just Larimer County.
Thank you, Brian. That's your presentation. But a couple more presentations and then we'll have some conversation. So thank you for that. I really appreciate your work. Harvest House or Harvest Farm, I'm sorry.
Call it Harvest House, that's okay.
All right, sweet. Who made the decision to limit it to 15 minutes for us this week? I only asked because my wife wanted to say that was very smart when I told her I was limited to 15 minutes today. So for those of you who haven't met before, my name is Kyle McPherson. I'm the program director at Harvest Farm located in Wellington, Colorado. Next slide. So I presented already, but a brief recap of us. We're a long-term recovery program for men experiencing homelessness and battling substance abuse. So 72 program beds, 4 beds in our peer house, leading us to a total of 76 residents that we could have on our site at any given time. Today we have 75. So as you can see, we're quite full, and the cold is certainly a motivating factor for that. Next slide, please. As we stated, we have four metrics to graduate from our program. Sobriety, of course, being the key one. Housing, so we'll help men find housing in order to graduate from our program. Certainly an important factor. Income sufficient to support themselves. Primarily, that would be employment, although SSDI certainly qualifies. And then a healthy community. We want them connected because if the totality of their recovery and their sobriety depends on us, then we've done them a disservice. We don't want them dependent on us. We want them independent and self-sufficient. So that's why we work so closely with the community here in Larimer County. Next slide, please. So this is an important one to me, some important statistics. I thought a lot about, why do I do this work? Why do I work at Harvest Farm specifically? What's the significance to me? So prior to this, I worked in private treatment centers. And in private treatment center, you say no far more than you say yes, because someone doesn't have the cash to afford treatment, which is really difficult. Their insurance doesn't cover it, or even difficulties we run into, someone doesn't renew their Medicaid policy. They don't click a box or check a box that they need to in order to have Medicaid. They decide, hey, I want help, I want services, they call in. Well, by the time they get their Medicaid activated, those services are no longer available. So it's really tough. And when you see this, what's so sad to me is that only 10.3% of people with SUD receive services for SUD. And that's heartbreaking to me. And I think it is for everyone in here. Because I understand that not everyone wants treatment, but where I really struggle is when people want treatment and they're unable to obtain treatment. And that's the gap we're trying to fill. We're trying to say, finances, if you want to tell us about them at intake, great. Otherwise, we really don't care at that time. Do you want to come in? Do you want to get help? Do you want to get better? Great, let's focus on those things and see how we can accomplish those goals. Finances can be worked out later because we're very blessed and very fortunate to have the support from donors as well as grants that allow us to do the work that we do. Next slide, please. So I get asked all the time about expansion. Do you want to grow? Do you want to grow? Do you want to grow? The answer is always yes. Then there's a but. I'll certainly get to the but the answer has always been yes. So for us, it's our goal to expand by 8 beds at the program. So we want to add 8 more beds to our facility that's on 110 acres for men who need and want care to be able to access that care. And that comes out to us, our proposal is for $446,000. Now, the last 2 numbers on there I think are significant because if you look at National Center for Drug Abuse Statistics, it will tell you that Colorado, the average cost of treatment is about $50,000 per treatment. So your average person battling substance abuse falls below the poverty line. So it means, again, for most, it's unavailable. And for your treatment providers to bill or charge accept out-of-pocket fees for them, if their numbers go up, well, so does their revenue, so do their fees. For us, our numbers go up. It's not a direct correlation, right? It's not something that we see, although we want to provide that service and we think we can. So we believe that with this, if you look at a year of care, for even 8 additional men at a rate of $50,000, it comes out to about $4 million worth of services that you would see at another agency that we have here in Colorado. Next slide, please. So this is our goal. This is what we think we can accomplish. We increase by 8 beds. So nights of shelter, we want to provide 25,000, serve 53,000 meals, help 95 men obtain housing, help 68 men obtain employment, graduate 48 men, and bring the total men who participate in our program up from 140 to 155. That's all while not charging them anything. So that's not changing our fee structure. That's not doing anything there. Next slide, please. So the butt of why we haven't expanded since 2006 is, I won't get into the story of an organization called Mercy Farm, but that's who we took over from way back when. Needless to say, the buildings were not done incredibly well at the time. And so it leaves us some infrastructure difficulties. So we have spent $17,000 since November on our septic system. We're not on city water, unfortunately, and that presents its own difficulties. Septics are expensive, and adding 8 more beds for men who are using those all day, every day, adds expense and creates difficulty. The next is the financial barrier. As I said, for us, we increase beds, revenue doesn't go up because we're committed to not charging individuals to receive services from us. That's something that we want to hold so that way if someone, regardless of why they don't have insurance or why they don't have money, can still access care. And we're committed to that. And I think that aligns with an organization like Longview, who has also said, if you don't have insurance and you don't have money, but you want to come in and get detox, get sober, get help, well, you can do that and we'll help you. And then we can be there to bridge that gap for those individuals. Next slide, please. And so this is the breakdown for us. So after meeting with 2 contractors and working with them, came out to a total of $340,000 to remodel and renovate a space on our property to provide 8 more beds. Septic system replacement would be $50,000, increased utilities of 11, 10% administration fees of $45,000, bringing us to the $446,000 total. And also leaving us in a space where down the road, we're then able to expand further if it seems like the right thing to do. But at this time, this is our objective and what we're trying to do. Next slide. That's it. I made good time. Questions, please.
Questions? I have one. So this is unfinished basement.
Correct.
Okay. And that would lead to the 8 beds.
Yep, that would lead to the 8 beds. And that's also with us being able to provide sprinkler systems if necessary, egresses for men to exit, and with the goal of not having it just be a space where men can stay or live. We want it to be a nice, accommodating space. We don't want to just expand for the sake of expanding. If we're going to do it, we don't want to do it well. It's been our goal for a long time to provide a program that's free that doesn't feel free. We don't want to lower our standards in order just to bring men. And so that, yeah, long answer, yes.
Councilperson Black.
Thank you. I appreciate it. I noticed on your diagram, it didn't show alcohol, showed all the other drugs, and I'm wondering, Larimer County has a huge alcohol problem. We're rising in deaths because of alcohol, and I just wondered where that was on the spectrum with the other drugs on your chart.
Sure. So the chart I think you're referring to is the one from National Center for Drug Abuse Statistics. I'm thinking of the right one, but for us, alcohol is the most common substance abuse that we're working with. So that's the highest rate that we're working with at Harvest Farm. Of course, it may be for some a primary or secondary, but alcohol is the most common that we serve.
Thank you. Thank you so much for all your work, Kyle. Appreciate it.
Very welcome.
The additional 8 or somehow figured that would be specifically for Larimer County residents who want to go, who need to go into or want to go into.
Sure. Yeah, it's a great question. So with us, it's our goal and our objective to really target those that are experiencing homelessness in our community because we're a branch of the Fort Collins Rescue Mission. So that's a main objective. And as we're located here in Northern Colorado, predominant percentage of men that we receive that come to us are from Larimer County. However, if someone wants help, we do want to help them. So we've never been in a space where we've restricted access based off the county or last known address. Although I think it's very fair to say that by increasing beds, it's going to increase the number of men that come to us from Larimer County, specifically with the main target of ours being increasing referrals from shelter with our project of building and expanding our shelter services. It's our goal to be prepared for that, so that way men can go from shelter to harvest farm and then back in as productive members of society.
That note, we should probably hit our social connectivity.
Yes.
Before our time's up. That's right.
Yeah. He's going to present on the social connectivity.
It should be on the same PowerPoint. So when we're talking about social connectivity, we're mostly talking about relationship. So we also wanted to ask for funding that involve staff that could both support an expansion, if that's what you deem as something you want to fund, but also for those that are most vulnerable in our community, increase the shelter to recovery pipeline. We think that is absolutely important. So Fort Collins Rescue Mission, sister organization underneath Denver Rescue Mission, but connected to Harvest Farm. We have 89 beds over the summer and 159 during the winter. We've been operating as 24/7 since 2021. We had another grant that we received a little bit less than half to support us providing 24/7 shelter. And I want to explain to you why 24/7 shelter is something that it would be worthy for the Regional Opioid Abatement Council to fund, because having shelter as a resting place for those experiencing homelessness, whether they have substance use or not, is really important to give them a staging ground for Harvest Farm. So how does somebody who is trying desperately to survive day to day actually get into recovery, residential recovery to boot? Well, first you need the free program, a donor funded program, but then you also need the people that can talk to that person and get them to a place where they can imagine a future that includes sobriety. And 24/7 sheltering allows that space so that somebody doesn't have to think about where they're sleeping the next night. They know where that is, and that's Fort Collins Rescue Mission. And then they can start to think about how to tackle their addiction. Yeah, we can just go through these. I'll go quickly. So these are the nights of shelter that we offer currently. I want to highlight this. Dependent on 24/7 sheltering, we could not do 705 case management sessions. We could not have the small groups, which include Celebrate Recovery, NA, AA, the kinds of small groups that get people out of their situation that brought them into homelessness. Stable housing, these are all statistics from 2023. Obtaining employment and connected or referred to other organizations like Summit Stone, like Front Range Clinic, that are also involved in addiction services. We can't do this work if we have to shut down during the day and only accept people at night. Really, the bulk of this work happens during the day. So what we hope to do is continue our 24/7 shelter operations and increase the referrals from homelessness into Harvest Farm. And to do that, we need to fund the two Fort Collins Rescue Mission positions that were underfunded in order to keep 24/7 operations, and then an intake case manager to help with the more logistics that bringing people out of homelessness require, and an additional case manager at Harvest Farm. So for the two, what we call community life coordinators at Fort Collins Rescue Mission, that adds up to $91,000, and the intake and case managers is $156,000. The total that we're asking for social connectivity is $247,000. And I want to stress that this will increase the referrals out of homelessness into recovery, as well as all of the other benefits that Harvest Farm presents in obtaining housing and getting healthy community, income, and employment. And also keep the shelter operating in such a way that we provide a pathway out of homelessness and not just a Band-Aid on homelessness. My last comment before answering questions also is we are open to partial funding on the social connectivity. Of course, we'd love to have all of this, but that's something that the first priority is that 24/7 sheltering so that we give people a pathway out of homelessness. Other questions?
Yes.
So, where Harvest House is only men, but now you're talking about all.
Well, Fort Collins Rescue Mission is only men
Is it
as
just
well.
men? Okay.
Catholic Charities serves the
Is
women.
that where the
experiencing
women, okay,
homelessness.
I wasn't sure
And
if it
families.
was split. Okay.
Yeah, good question.
Thank you.
Yes.
Do you have a sense for how many, I know you have a slide that had how many referrals, but I don't know that it was referrals that you know of, like in 2023 that were from Rescue Mission to Harvest Farm? Because I know, because there's a little bit of, so 8 beds, makes you think there's only 8. So I wanted to just know how many actually that.
Do we know how many referrals we had last year? 21?
21. So the goal is to increase that to 40.
Yeah.
Yeah.
And we really think we can hit that goal.
Well, first, you both were kind enough to give me a tour of Harvest Harvest earlier this week, so thank you for that. It's a great facility. I think one of the things that distinguishes it is the sort of duration of the program at Harvest Farm. So I was wondering if you could just sort of say a word about what y'all are achieving in that longer period of time.
Yeah, especially for those that come to us with nothing whatsoever, sometimes not even an ID or birth certificate. The duration of 6 to 12 months really allows people not only to get the case management work, to have vital documents, as well as time of sobriety. But also the last part of our program functions as sober living, where we have given them the tools to get a job, and they can get that job while they're still in our program and go out into the community for the majority of the day, but have a safe housing and community situation to weather the new challenges that come when you're trying to maintain sobriety, but you're also trying to maintain a job and look for housing. And then, as Kyle mentioned also, the long-term program also allows people to find housing, which we all know is difficult in Larimer County, and sometimes can take several months. So, yeah, that's, it makes sense research-wise as far as sobriety, that long-term recovery solutions have better outcomes. But when it connects to homelessness, it also helps them get their feet underneath them.
Thank you very much, Seth and Brian. Appreciate that, all the work you do. Yarrow Collector.
If I'm having some unstable internet, could you actually share from your? So hi, everyone. Thank you for having us back. My name is Silent, as in silent without a T. I use they or he pronouns, and I'm the executive director of the Yarrow Collective.
Oh, and I'm Lucrecia, I use she pronouns, and I'm the harm reduction and BIPOC program director.
I'm noticing our Google slide gets wonky when it turns into a PC slide, so apologies for that. Just as a reminder, it's lovely to be back here. Our mission is to offer peer support for folks struggling with mental health or substance use struggles. And you all saw some of these slides last time, so I'm gonna breeze through them so we can get to the real report here today. We use the word peer to refer to anyone with lived experience of substance use struggles, mental health diagnoses, oppression, houselessness, trauma. We use a really wide umbrella because for some folks that we see, they still identify with their diagnoses. For some folks that we see, they may have moved away from those and are defining their experience in different ways. So our peer support is really about empowering people to define their narrative in the ways that are most meaningful and empowering to them.
So our harm reduction peer support values are we see harm reduction as a philosophy beyond public health, autonomy and respect, responses to injustice and stigma, and liberatory practice and community. Oh, sorry, that's my slide. So we surveyed 78 participants of our peer support group programming, and the feedback that we got was they want a sense of community and connection without judgment, healing spaces, and sharing about things they don't feel safe talking about elsewhere. But really the overall theme was a sense of normalcy, right? A space without someone talking about an issue that they're struggling with, without someone being like, let's get you here. Really just a sense of normalcy in the community, a sense of just connecting without the outer things, if you will.
And for those folks who filled out our written surveys in the last few months, the image got a little cut off here, but 4 and 5 are agree and strongly agree. So the majority of participants coming to our groups feel less alone because they are coming. So really wanting to highlight this point as we ask for funding to create more spaces to decrease those feelings of loneliness for our participants and for others in the community who will come to our spaces.
What people want from future programming is gatherings of groups that intersect all the groups to promote networking in community, creative groups, spaces to connect, and activities like, painting, hanging out, again, a sense of normalcy. Who we currently serve across all of our groups in 2023, among those who voluntarily gave their demographic information, 98.2 reported having a marginalized identity. You can see the numbers next to the overall percentages next to the identities. What's really cool about this is a lot of our peers hold a lot of these identities. So we essentially are who we're serving, which.
Yeah, and this is data from hundreds of our group participants. It's pretty fresh. We just calculated all a few weeks ago for our overall 2023 numbers, and we're really proud to see this. And some of our spaces are affinity spaces, so they're identity specific. We have a couple of BIPOC groups, a reduction-oriented BIPOC group, a chronic illness and disability group. But a lot of our spaces are open to everyone, but we see that our participants end up having marginalized identities because they see themselves in the people who are holding those spaces. And the vast majority of our facilitators and our core team have one of the identities that you see on the screen.
So we went over this last time, but we'll review it briefly. We have since added a new group, but we have 4 harm reduction groups. We have our mobile harm reduction group, Risk Plus Live More, at the Murphy Center, Saving Ourselves for BIPOC individuals, and then New Site, which is at the Latimer County Jail, which we just started last week. So.
Then outside of groups, we are also beginning to build a one-on-one peer support program. This is newer for us, so we haven't seen quite as many individuals in this area of our programming than our support groups. But over the last 6 months, we've had 289 drop-ins among 159 unique folks that are receiving harm reduction groups specifically. And then for one-on-one peer support sessions, these are mainly in the jails and re-entry navigation support. And we're starting to build that up as well.
So some barriers for accessing our programming is transportation and materials. Currently we're meeting our folks where they're at to remove as many barriers as possible, and materials and doing more local events. Some participants don't have gear like walking shoes or the, things that they need to be able to participate in our programming.
So that leads us into our proposal for all of you to increase these opportunities for social connection by offering more safe spaces for folks of marginalized identities to connect. We want to have more series where folks can come and participate in arts and outdoor pro-social activities. Right now, the majority of our programs are talk-based. We sit in groups and we're sharing our deepest truths. And what we've seen from the surveys of our group participants we've done over the last few months is that folks love that. They feel safe in that space. And they also want a space where maybe they're not asked to share their deepest truth, but they're doing something with their hands. They're making art. There's sort of less pressure to share themselves and might make connections in different ways. So our first objective is to implement a twice monthly art and outdoor pro-social event series. So one artistic oriented event a month, one outdoor oriented event a month, such as a hike or a basketball tournament. Our coworker Kyle really wants to lead a basketball tournament. This image you see on the screen is from a pot painting event that we did last summer, but we haven't been able to do something like this in the last few months just because of our bandwidth and our capacity. So having more funds to support staff time towards these events and more funds to support supplies towards these events. Our second objective is to coordinate quarterly larger social gatherings, featuring special events targeted for people who use drugs of marginalized identities. So these might be things like film screenings. These might be things like ceremonies that are culturally relevant for folks of color. This is another picture from a picnic we had for peer supporters last summer. So more spaces like this. And then our last objective is to reduce the barriers to access and participation. So being able to have a fund for supplies, art supplies like you see on the screen, as well as Lucrecia mentioned, being able to lend people hiking boots if we're going on a hike and they don't have adequate gear to safely participate in some of these activities that we're hoping to bring to our programming. And then also alongside of that, reducing this barrier to transportation. So currently, none of our staff have the right insurance to be able to drive folks that we're serving. So that's something we're hoping to grow into so that folks who request that as a need to participate, we can be able to provide that. Since a lot of times, like Lucrecia mentioned, we meet people where we're at. We're hosting a lot of our groups along bus lines. And we're mindful of that when we make our new groups. But if we're going to a hiking trail, we might be going out to somewhere that is not very accessible via bus lines or biking. So this is just a review of the other groups that we have going on. You all saw this last time, just to highlight a lot of the things we have. But that's what we have for you, and we can open up for questions now about this proposal.
What was the dollar amount? Is that the 117?
Yeah, so 117,000 total.
Question, yes.
Just for clarification, the new events you're proposing to be added are open to all the people who join the different groups you have on teams, and like, so anyone can go to those, is that right?
We'd probably make them adult specific and more substance use specific, targeted towards those harm reduction group participants. Yeah.
Oh, yes.
Sorry, go ahead.
Okay, Silent. Thank you, appreciate it. So is this primarily Fort Collins residents for those that aren't in the unhoused group?
Yes, so far it is.
Okay. I've just wondered, I noticed on our funding that we do have funding for safe spaces that we've not yet allocated. Am I correct on that? Or am I reading that budget wrong? The ROAC budget.
Yeah, there's two there, councilperson elected, one for housing and one for social connectivity. And those which would be a safe place or a third place for people. So that's what, yeah, that would be part of the social connections.
Great. And I love the transportation piece because that's one of the highest barriers for most people, regardless if you're in the senior population, the disabled population, in the recovery population. Transportation is the biggest barrier for pro-social activities. So I appreciate that aspect. Thanks so much.
Thank you. And I forgot to mention, we would be open to partial funding as well and just adjust some of the outcomes. So we're flexible there. Any other questions for us?
Any other questions? Stephen, thank you. Great work that you all do. Appreciate that. Okay, council members, now we'll move to the bottom part of item 8, and that's discuss proposals. I'll open it up. We do have these three, and I just started kind of doing some math here. We're close in the connectedness part, to be over a little bit in the housing part. So, but what we bucketed, but both are actually a little bit over. So, anyway, open it up for conversation. Oh, go ahead.
So I wanted to kind of, just as a council, and kind of reflect on this a little bit, and I'm glad that Councilwoman Black brought this up, Councilor Black brought this up. I want to be very aware and sensitive to, of course, I love Fort Collins, but being Fort Collins centric, we have a lot of needs throughout the county, and if transportation is a barrier, you know, I just want to kind of think about that as we're funding things that we're not funding them in one half or one portion of the county. I know they say they're Lamar County specific, but I do think there's still a need in the southern part of the county that, and even, and that's this part that in the school district proposal, we obviously feel that's really targeting and helping that. So I kind of want to just, as a commissioner who pounds this drum all the time, as the only one who lives in unincorporated Lamar County, the other county served and worked hard for. I just want to kind of think about that because we do have a crisis in our rural parts of our county. in many ways for health, and I do think there is some substance abuse and opiate abuse in our rural community. So I just kind of wanted to bring that up as something that I'm just looking at this and want to make sure we're trying to make sure we're allowing other communities to have access. So I'm just thinking.
Thank you for that. Other thoughts, comments?
Can we bring up the budget graph? Yeah, actually, if you look in your packet, I was trying to read it. That's the previous one. I'll take over. That I found it. It is small in paper.
This one.
Yes, yeah, that's what I'm trying to look at. So that shows what the council has budgeted for each approved use and what has been allocated. I think these have any page numbers. Just makes it more challenging.
We've got it up on this. Get a little zoom in a little close there.
So the first approved use, the criminal justice involved persons. So that's spoken for by the sheriff's office. People in treatment and recovery, that's been allocated. And then the third one is that housing piece, the 611,740, that's one of the ones we're talking about. And then the first one in blue is CSU, and the council had allocated 400,000, also is for 3. And then the next one is the social connections, and that's the 611,740 that the group is also talking about.
May I ask a question? Was the Abundance Foundation, was that requested under housing or under the social connections piece?
It's under both.
They have two both.
Okay. Thank you.
It was 345 for housing and 250 for social.
It was 300.
Yeah.
Yeah.
Oh,
Yeah.
okay.
I mean, it's good.
Oh, I was just gonna comment, I think, I thank you for bringing up the need countywide. This is full county. And I just want to bring up the point that I think a lot of these services are open to the whole county, and they tend to be in Fort Collins as the county seat and that kind of thing. These aren't services that are only provided to Fort Collins residents or people who all Fort Collins are home. So for housing and stuff, it's harder to have sheltering and housing all over the county, and tends to be focused Collins and Butler. Wellington.
Well, and I appreciate that comment. I'm just saying maybe we need to track that just so that we are aware, so that, you know what I'm saying? I just want to kind of keep in the back of our minds. You know, I love Fort Collins, but you know, it just, I can see how, I hear it from the other parts of the county, like, hey, we have folks that need help too, and feel like we're trying to use these, but they're all filled all the time. So of course, I agree, they're all open. I didn't hear anyone say, well, it's only open for this, but I just, you know, with transportation being a barrier and those things, I just wanted to just kind of ask if we could kind of just keep that back in our minds, and maybe we ask, that's something that our data collection is, what zip code does the person that you served come from? Just kind of help track that, but I agree with you, but I just wanted to kind of give that caution, just kind of like the Teen Activity Center across the street here that the commissioners help. It's Fort Collins. It's right off the bus thing. I know they're looking to expand further and stuff, but that's a source of social connection. I know that they're looking at that. I just kind of wanted to just kind of that as we're talking. Thank you.
What I throw out is on the social connection, activeness and safe spaces. Was there one that resonated that you thought, wow, that's something I really can support just to try to get the conversation going?
Two come to mind from the two for me, the Fort Collins Rescue Mission connection with Harvest Farm, I think is a very strong one because of the need there and the fact that if they aren't able to continue being 24/7, then they lose that ability to be connected to people and refer to Harvest Farm. And then I think Yarrow Collective is very strong for social connection as well. And those are new and added social connection activities that I think would also be good. Maybe point of clarification, would those be in kind of throughout the county or offered in different locations?
Yeah, we're open to that, especially with increased support for transportation and staff mileage. I mean, Lucretia already lives in Severance. I live in South Fort Collins. It's just as far a drive for me to get to Loveland as downtown. So yeah, we're very open to hosting those in different places in the county. Thank you.
Thank you. And thanks for asking that question, Beth. So I guess I know we should have maybe asked these questions earlier, but that would help me that if you were looking to expand into, well, then there are obviously, Counselor Black, I'm looking at you. Obviously we have maybe connections in places that might be open for you to have meeting spaces, and certainly, I would feel a little more comfortable if we thought if that transportation there was help reduced for your work that and you were looking to expand, that would make me feel a little bit more confident about investing in that. So I'm hoping that you're open to that and maybe if we can help with the barrier to location for free or donating or something like that, just something that would make warm my heart and make me feel like we're kind of serving a larger geographical area. Thank you.
And I agree, if we're able to come up with a donated space up in Estes Park, would you be willing to go up and work up in that area as well on a designated, a certain time of the month or what have you?
Yes, sure. And part of the proposal too is having some increased staff time. So I think working that into some of the hours would be simple. And I don't, not to put Shane on the spot, but still have Shane's business card on me to connect with some more spaces in Loveland, get into.
Yep, Loveland will welcome you, Silent. I just want to agree with the gal. I'm sorry, I can't see the name tags. You're sitting right by Tom.
Yeah.
Hi, I agree with you. I would lend my support for the social connectivity piece request from Harvest Farm and from the Yarrow Collective.
Brian, you got a reference there?
No, I certainly think I really enjoyed Harvest Farm's presentation, and obviously me being in Wellington, I've seen I've actually had the opportunity to meet a number of folks that have come out of that program. So I think it's very successful and certainly a venture worth funding. So certainly stand behind those folks. And as far as what the rest of the council thinks, I would be inclined. I think all three of these groups have had fantastic presentations, and seems like they've all got a pretty solid track record. So I would be fine with whatever the council determines today.
I also think abundance, finding that the pieces of taking them out, outdoors and providing for, and I think that is something that, and so I think maybe we can, they're all open to partial funding, maybe we can.
We also have the option to open 2 properties in Loveland. Like it's on there. There's 2 that are in Fort Collins, there's 2 that are in Loveland. If Harmony would actually take Medicaid, we could do Estes Park, but they don't. So that's been the battle with that. But,
So that would be the housing piece, or?
yeah, so I mean, we do have the opportunity to do it, to expand that way. It's just Fort Collins has been easy to be a central hub.
Yeah, and I'm just thinking about the social connection.
Oh,
I don't know what numbers, but I'm just thinking.
My Matt agreed I got CSU. Go around. It's 651,000 about, we have 611. So we are close with all three. It's not, about 40,000 here and there. And yes, ma'am.
I was just checking because I thought we had enough for.
Yeah, and again, I could, my one math class I took. Was there a hand up over here?
It's 614 total for all free and social.
It is.
That's
So
what
my
I-
math was way high. See, that's how I'm always under budget.
614 is a nice number.
Yours are way better.
So this is what I'm showing, abundance, this is the rescue, and then yarrow, so it comes to 614 and we have 611. So
Mr. Chair,
I shy.
I just want to make sure that our lived experience members have an opportunity to pipe in, and I'd really love to hear from them what their thoughts are on what we heard.
Yep, we're at time, so
Right. I have lived experience with Harvest Farm and graduate. And so it's near and dear to my heart, and he has 20 years of sobriety. So he graduated many years ago. And he, as his 12-step work, works with homeless in Loveland. And we desperately need 24/7 shelter and support. So both of those programs are needed in Loveland. Many of the guys won't go to shelter at all. So imagine if they had a coach, it would change their lives. The other thing I believe in is trauma-informed care, because I was trained in it, I'm an artist. And so I would love to help in these yarrow events, so all of them, but 24/7 care.
Thank you for that. So it is 4:02. I want to first ask, be respectful to the council and all the members here. We do have some hands up. Is that okay to proceed, or do we need to adjourn the meeting?
Well, I'm wondering if I think we have to take a vote to start the meeting, because I just know how it is. Attorney General Authority for South Council meetings, we have to vote and have a unanimous decision to extend the meeting, and we have to say maybe extend by 10 minutes. We publicly noticed it, so just.
Is there a motion?
I'll make that motion.
To extend by 10 minutes.
By 10 minutes, we just gotta be carried, because I have a time crunch too, so I would second.
Anybody opposed? Okay, we're expanding the meeting by 10 minutes. Okay, Shane?
Hello, everyone. Can you hear me?
We can, yes.
Cool. Greetings. I really did enjoy all three presentations. Thank you all for the strong work you are doing in our communities. I do really respect what the Yarrow Collective is doing. I believe they're accessing and serving a vastly underserved community in ways that are very effective. So I'm all for that. Of course, I have a huge heart for our unhoused populations. I do respect very much the work going on there. I guess my question to the council would be, is this something we are voting on today, or is there further discussion to be had around the most effective uses of this money in these directions? I think we need to very much focus on accessible housing and how those dollars are best spent, where they are most effective, right? Dollar for dollar in getting people in beds. I think both Harvest Farms and the Abundance Foundation are doing some strong work there, but perhaps there are other places to explore. And that would be my 2 cents. Thank you.
Thank you. Comments?
Wasn't anybody, I mean, we accept everybody's presentation, so there isn't anybody that we've turned away for a presentation.
Within the housing part, so with safe spaces, if you did accept all three, the ask would be about $3,000 over, just shy of 3,000. So we're really close there. Housing, it's a little different. It would be $134,000, exceeding the 611 that we put in the bucket. Out of the Abundance and Harvest, anything rise there that they really appreciated and liked?
I guess I just appreciate, we go out up to a certain women, especially when mentioning kind of the range of women that, I mean, home stay-at-home moms and folks that were involved. It's just, I just think that, I appreciate that. I think, we have it. And I'm looking forward to that data that we can make, we would have more of a kind of informed, like how much women versus men. And I think that is, just something to think about, but I kind of appreciate that. So I think,
That's on.
yeah,
Okay,
yeah.
sure, it's better. Yes, ma'am.
Can I make a suggestion that perhaps we vote on the social inclusion, social connection ones today and then hold on the housing ones? So since we're over and have a little more conversation specific about like what Shane brought up, what you're bringing up, and that way we can have a little more discussion on those.
Hold on, I want to make sure, is that something we can do? Because we have to submit this to COAG.
You can absolutely do that.
Great. Okay, so.
That was my question, but also, do we want to wait on both of them and vote next time? Because
you can certainly do that. There's no time limit from
Good.
the color.
Thank you for that.
I'm thinking, now we've got the full presentations and we kind of have, how much we're over and not over. I'd like to just, I think we need to have more,
Sure.
I don't know, I would like more discussion, but I'm open to the councils.
So we've got one that we could, what about just doing safe spaces, housing later? We got, what if we do both later? Other thoughts from the voting members?
I would be okay doing the social piece today.
Okay.
I think the housing is a little bit more, more in depth.
Okay.
I agree.
Online.
I agree with that.
Brian?
Honestly, I agree with the commissioner. I would like to see a little bit more discussion, especially if we were to decide to shift some of that money around a little bit. But again, I'll go with whatever the council majority wants to do.
Okay. I have a motion.
I'll make a motion to move forward with supporting the 3 proposals for social connections.
However, we're over, so we have to amend their maps. That's why I'm wondering if we should vote, because we're over a bucket. And so we need, I thought was to reduce everyone by $1,100 or something, but I just don't feel like we had that discussion. I thought we should be just equal and reduce them all.
So we do have a motion. Motion, is there a second?
Second.
But my comment is.
So now we can have discussion.
But I just feel like we're gonna have to lower those amounts. And
Sure,
that-
I hear you, but I had to honor the motion.
No, I agree.
So we have a motion and second. We do have a conversation here that it's over $2,979. Further conversation.
I suggest we take the 3,000 over off of off of the rescue missions, because they said that they were able to go less.
I'll second that. Yeah, I agree.
Well, that worked. It's okay. So I'm making sure that, you're making an amendment to the motion that it would be, we'll accept the 3, but taking $2,979 off of the harvest fund.
Yes.
Yes. Yes. Well, I have the second on that.
Yes, second.
Now conversation.
I just really agree with that because, I really felt that they were true, that they had a little bit of leeway on that. And I would really like that full amount to go to Yarrow. I think that transportation piece is very important. And I hold you to be more spread out with your meetings and meeting in other areas of their county. So that I think will take more of the money. So I totally agree.
Online, thumbs up. Brian, okay. All past anything, all those in favor?
Aye.
Anybody opposed? Hearing none, that passes unanimously. What I understand there is the desire of ROAC to table the housing piece. We need to have more conversation around that.
I move that we table that decision until next meeting and put it at the top of the agenda to So we make sure we get that taken care of.
Perfect. Second, any conversation?
I would love to have, which I'm sure will be put out in minutes, but, you know, a breakdown of, on the chart of what each one had proposed.
Sure.
Make sure my notes are correct.
Look, we'll make sure. That's a great suggestion to the motions. Any further conversations or suggestions? None? Anybody oppose that? That passes unanimous and it's 410.
I make a motion.
Can I just ask that there was a lot of discussion about maybe changing the scope of work for Yarrow? Do you want them to resubmit a scope of work that shows expanded services to other areas?
Yeah, if you want an amended proposal, or if we want to just sort that out in a contract
I would like it.
to stipulate a certain number of events outside.
Yeah, I would appreciate that.
That good?
Yes, when do you need a proposal by?
Do you have it in 8 days, 10 days?
Yep.
Thank you.
Okay, so I will now make a motion, Mr. Chair, to adjourn.
Anybody oppose? Everyone, thank you. Good work. Thank you. Thank you.
Thanks, everybody.
Thank you.